Now let's talk about community-based education, DME 2115. So in here we'll talk about community diagnosis. Some things we'll discuss will include the community health nursing, community diagnosis, purpose of community diagnosis, types of community diagnosis, and also just describe community diagnosis process and other things. So to start with, a community is a group of people living in a common locality and share the same interests, beliefs, and also norms. Now, community diagnosis is going to be the identification and the quantification of health problems in a given community. And we talk about these health problems in terms of mortality and morbidity rates and ratios. Now, we are talking about identification and quantification of health problems. For example, you can say this community has got cholera. So that is identification. Now, quantification, you are talking about how high are let's say, the spread of the disease, or how effective is it? That is quantification. Now we are saying we get to describe health problems in terms of mortality and morbidity. Morbidity is the state of just being unhealthy for a particular disease or situation. Mortality is the number of deaths which occur in a population. Another thing that we need to understand is community health. So community health is just the health status of the community, the problems that affect the community, the health of that community, and also the totality of the health care which is going to be provided to that community. So that is going to be community health. It is a branch of public health which is real alternative for the provision of essential health care. Okay. So it is important to understand community health because it forms an integral part for both the country's health system, of which is the central function of and the main focus, and of the overall social economic development of the country. So understanding community health is going to be very vital in social and economic development of the country, because imagine the community health is not good, most of the resources are going to be projected in making sure that community health is restored. So economically, money is going to be spent on only one part, and that is going to be on the expense of other parts of the economy. And socially, say there is cholera, people will be trying by all means to stay away from others, and that will affect the interaction of others. So that affects social development of that community. So in community health, the whole community is going to be a client, and the services should be focused. So in community health, it is important to first know the community. So that is known as community identification. It is also important to identify the health needs of that community. That is going to be referred to as community diagnosis. And also understand underlying factors affecting health problems. Is there clean water, clean sanitation, and everything else? So those are underlying factors that can affect the health, that can affect health problems, of course. Now, it is also important, after you have identified these problems, to plan and implement comprehensive services, because what you want to make sure is that when you identify problems in the community, you do something that will be able to mitigate those problems. All right, so we'll get to do the introduction to community health now. We already know what community health is. So basically, the community has no boundaries. So everyone is going to be involved in all stages of a comprehensive care. If you want to have a good community health, everyone has to be involved. Changes in community health may take long since it involves everybody, but once it occurs, it is going to be permanent. Okay. So community health is going to encompass the entire health illness continuum and deals with people from all walks of life. That is basically community health. It is talking about everyone in that community and basically everyone living in there. It doesn't matter their race and whatsoever. Okay. Practicing community health involves a high level of autonomy, and decisions are going to be made with reference to theories of public and community health nursing. The community health worker must be well conversant with the many legislations and guidelines of practice in the country so that he or she can operate as expected. Imagine you are the health practitioner. How do you make sure that you get to work as you are expected to work as a health practitioner? You need to make sure that you understand the rules and regulations, the guidelines that guide the practice of your health care in that country that you are in. Okay. Now, when you're talking about community health, there are three scopes that you should be able to understand. So, in community health, remember, we're just talking about things that can affect the well being of a community. Now, after you have identified these things that can affect the well being of a community, you can actually get to prevent them. There is primary level of prevention, secondary level of prevention, and tertiary level of prevention. Now, when you're talking about the primary prevention, this is going to involve health maintenance, and the first way you do it is via health promotion. Now, in primary prevention, the main thing is, think of this. You know there is possibility of having a certain disease, but before the outbreak of that disease, you want to do whatsoever that you can do to prevent its outbreak. That is basically primary prevention. So you can prevent any disease from getting to break in the community, one, by health promotion. And health promotion is going to involve cultivating good nutrition, adjusting to various phases of development, health living practices, attention to personality development, good housing, recreation, occupation. So basically, you are just involving a lot of things. Regular medical examination. You are going for regular medical examinations and checkup even when not sick, because you want to make sure that you prevent anything that can make you to be sick. Practicing good health or personal hygiene and any daily activities that is going to promote a good health. That is one thing that you're able to do in primary prevention. Okay. So sensitization through health education is very much essential when it comes to health promotion. That is why you see health practitioners going out there in the community distributing all papers and everything so that people are aware to prevent a disease from catching them while it has not yet become very bad. So this is primary prevention. So the first way we can carry out primary prevention is by health promotion. Another way is specific protection. Now, in specific protection, it is protection which is specific against a specific disease, and this is going to be done via immunization. That immunization we know can be active or passive. Now, when we are talking about active immunization, it means that our bodies are involved in making, let's say, antibodies to be able to fight a disease. Passive is something has already been made, but then it is transferred to the body. Say, for example, when you are breastfeeding, the child can take antibodies from the mother, which have already been made. That is passive. Now, active has to do with the body itself making antibodies. For example, a person is sick. So, because the person is sick, the body produces antibodies to fight that sickness. That is active. Okay. So, specific protection can be even via routine immunization of infants. Say, for example, immunization against polio and these other diseases. Also, routine immunization of all ages. selective immunization based on risk of exposure. For example, say there is an outbreak of a certain disease, for example, cholera. So you look at a community that is more exposed to that disease. And so what you do is that you get that community and you immunize people in that community because they are at a higher risk of exposure or higher risk of attaining that disease because they've been exposed. Also, chemo prophylaxis, also known as chemo prevention. Now, chemo prevention is the administration of a medication for the purpose of preventing disease or infection. So, you take medication so that you prevent the disease or infection from getting into you. Isolation and quarantine is also one of the specific ways of protection. Also, vector control is also another way of protecting yourself. For example, we know that vectors are basically disease causing organisms. So if you see, let's say, tall grass, you get to cut it because you know that mosquitoes can reside there, and also where you have got just stagnant waters and that you get to bury them. So that is the primary prevention. The other one is the secondary prevention. Now, secondary prevention, here you have got a quick health restoration. So in this one, you someone has now already gotten the disease, but before the disease can become worse, there is an early diagnosis and treatment. So just early when the person has gotten that disease, you identify the disease and you treat it. So this is important because you're going to be able to prevent or limit disability before the disease becomes worse. You can limit it. In secondary prevention here, there is an arrest, or you want to stop the disease process early in order to prevent further complications, because some diseases, immediately you allow them to grow more or to mature more, they become worse every time. Think of someone has attained a cancer or something. So before that cancer becomes worse, you want to do anything that you can do to prevent or limit it, because immediately it starts to spread, it will be all over the body and you'll not be able to do anything. That is secondary. Now, tertiary protection. This one is a rehabilitation after terminal or chronic illness. So here the condition has now worsened in a person. Now you want just to do something about it. So this is going to involve health education. You can educate those people who are already sick or now they can just make sure that they stay healthy in that situation. Also, train the people on how to cope now with the situation. And also there can be some counseling. Imagine someone has gotten HIV. There's nothing that you're able to do. So you can just get to counsel them so that they know how to live well. You can also get to refer them to other agencies or organizations for further management in case you have seen you cannot treat. You can also engage relevant community and other health organizations in tertiary protection. Now let's talk about the types of community. Now, when you're talking about our types of community, you have got rural community. This one is going to consist of basically villages. Okay, the villages are going to be self-sufficient units and they are going to provide routine requirements to their members. You also have urban communities. Now, these are towns and cities which are going to comprise of the urban community. Relatively, these are going to be large and then also dense communities. The lifestyle in urban communities is going to be diverse and modern. Also, occupation is going to be diverse and different. You see, this person is a doctor, this one is a nurse, this one is a teacher, this one is doing something else. Different from rural communities, you can find that maybe everyone is a hunter or everyone is a fisherman, but here there is occupation is diverse and different. Social life is also less intimate. You mostly see people just lock themselves in their gates. Traditional pattern of beliefs and behaviors tend to be also broken down. Mostly where you have got a lot of traditional beliefs and patterns are in the rural areas. Okay, but in urban communities, traditions have been broken. Ideas and behaviors also tend to spread to the rural community. Let's say someone just came to the urban, they saw a certain kind of dressing or something. When they get to go back to their rural, they spread that to the rural communities to which they have gone. Another type of community is known as peri-urban. These are communities which are near cities. They are dependent to the cities for jobs, recreation, business, and economic activities. So members have little in common because they are just basically dependent on the cities. Characteristics of communities. One thing is that for communities, people live together. And then there is also a continuous geographical area. If you're talking about a community, they should be in the same geographical area. If they've been split, let's say one place is here and then there's a very big ocean, or let's say a very big lake which separates from the other, you won't say those that's the same community. That would be another community. There is also cooperation in meeting people's needs in a community, and also members share common organizations such as markets, schools, hospitals, clinics, and these other things. Now, what is the purpose of community diagnosis? Remember, community diagnosis is basically identifying some health problems in the community. What is the purpose? One is to identify community needs. The other thing is to help to clarify community problems. You've seen this is a community problem. You want to clarify that community problem, also to help identify the community resources and strengths in a community, right? So that those are some purposes. Identify the community resources. What are the resources in this community? What are the strengths? That is the purpose of community diagnosis. Now we talk about community diagnosis first. We talk about a profile. A profile is basically a description of the community's state of health. The community's state of health. And that is going to be determined by physical, economic, political, and social factors. If you want to talk about how healthy a community is, you just don't look about how health, let's say in terms of physical needs of people. You also refer to the economy. Are people economically stable? Politically, are they stable? Socially, are they stable? That is a profile. So it's going to define the community and the state the community problems. So that is basically a profile. Now, what is the purpose of a community profile? Purpose is to be able to obtain a quick picture of a community, and this is going to be as accurate as possible. That is the purpose. Remember, a profile is the state of health. So the purpose is one to determine, to obtain a quick picture of a community. So if you know about a community profile, you should be able to know about, okay, some things about the physical, about the economic, about the political, and about the social factors in that community. So a community profile one should summarize information, also present results and figures clearly, and also be useful for planning and monitoring. Okay, we know, okay, this is the economic status of this community, this is the political status, this is the social status of this community. It is going to help in planning and also monitoring anything that comes about, right? Now we talk about community diagnosis as a process. Community diagnosis, it is going to be a continuous learning experience for the program coordinator and the staff, as well as the community people, for the following reasons. Okay, it is going to enable, so community diagnosis as a process is going to enable public health officers, program coordinators, or staffs to adjust or alter the program for optimum effectiveness. Community diagnosis as a process also allows the community to gradually become aware of the problems and solutions. Remember, community diagnosis is you have identified some problems in the community. So that is going to help the community to gradually become aware of the problems which the community is facing, and also some possible solutions. Also, community diagnosis as a process, this is an organized attempt to involve people in recognizing and resolving problems that concern them most. Okay, this is what is at hand. In the community, there is cholera. This affects you in this way. So you are getting to organize, it's an attempt to organize, okay, and also get to involve people just to make sure that they recognize and resolve problems. Community diagnosis also is going to enable the community to understand at its own pace the potential advantages of change which may eventually lead to alteration in attitude, values, and behavior. Imagine you have identified a new disease in the community. Understanding that disease in the community to enable the community to know that there can be a potential change, okay, or potential advantage. If people know that there can be a change, for example, currently there is cholera in the community. So when people understand that, that is going to alter the way people have been living. Their attitude, their behavior is going to be a bit changed. The way we've been social all this will not be the same as currently because of the situation in the community. Okay. Now, why should diagnosis be undertaken? Community diagnosis should be undertaken in order to have a clear picture of the problems of the community and to identify the resources which are going to be available to the community people, right? And also to set priorities for planning and developing programs of healthcare for the community. With the data that is going to be gathered through the process is going to serve as the material for analysis. So when you gather data about the community, it is going to be important and you use it to analyze the community. How health or how good is the community? Now, let's talk about the types of community diagnosis. The types of community diagnosis are going to vary according to the first one, the objectives or degree of detail or depth of the assessment. How much details do you want to find out about the community? So also the type of community diagnosis is going to be different depending on the how much detail you want to find out. Because community diagnosis you want to identify basically health conditions affecting the community. So if you want to find out a very much detailed information about the community, you do a different form of assessment about that community. Community diagnosis also, the type can be dependent on the resource and time available to conduct community diagnosis. Let's say we want to find out the problems affecting this community, but how much time do we have? Or how much resources do we have for us to be able to find out the problems affecting this community? So that will determine also the type of community diagnosis that you are going to be able to have at the end. So looking at these two ways through which we can be able to find out community diagnosis. Therefore, community diagnosis can be comprehensive community diagnosis. Comprehensive, this one is going to aim to obtain general information about the community or a certain population group. That is comprehensive, just general. Now, the other type is problem oriented community diagnosis. In here, this is a type of assessment that is going to respond to a particular need. For example, you have got, let's say, cholera. So you just want to find out much about the particular need in the community. That is problem oriented community diagnosis, different from comprehensive community diagnosis where you're just finding out general information about the community, how health is the community generally. Okay. So for example, say you have been confronted with a health and medical problem that is resulting from industrial waste being disposed into river systems by an industry. The first thing is we are going to start by investigating the meaning of the problem to the community people, and then proceed to identifying the population which is affected by that hazard. And also you characterize the environmental factors and other elements which are relevant to the community or to that problem in that case. So that is basically problem oriented community diagnosis. You look at a problem, you get to see how much it is affecting the community, what to what level or how big the community which is being affected is, and then you get to find out more about that and how you can get to fight that. All right, so in this part here we are going to end. We'll continue in the second part with community health nursing and the elements of comprehensive community diagnosis.